yesterday we had a very eye-opening meeting with people affected by infertility. And one of the things that came out very clearly is the number of myths around infertility. Because there's so many things that can cause it, we end up deciding ourselves what it is. So a lot of the ladies were talking about their suspicions that they were promiscuous. And as we live in a gendered world, a man who's infertile isn't accused of being promiscuous, it's the woman. We have, in the Ovambu traditions, there's this practice of okutsigirika, the first menstruation flow that goes, and your mother or grandmother has to keep that for you, and if she passes or she forgets where she put it, that's the reason why you can't have children. And these are deeply held beliefs. There's beliefs that you've been bewitched by your mother-in-law who doesn't like you. There are names being called, and you're seeing these ugly names finding themselves even in the political domain, where people who don't have children are being mocked for that. You're seeing people in the political arena saying to others, meme wa zero, tate wa zero, cement bar moeder, wind ballas, or whatever it is, what we say to one another. But we have these horrible names that we've normalized into our public discourse, which is not helpful. And I'm glad to see representatives of the Cancer Association here. I'm glad to see Dr. Kimberg, Dr. van der Korf, and other health practitioners, because part of what we want to do is to bust the myths and be more sensitive. I know even with myself, my goodness, I'm over 44 years old. My husband is hitting 80 soon, but you still have geniuses who keep on asking, has something happened there at State House? I don't understand it. It makes no logical sense. Between my husband and I, we can have a netball team. He's got 5 kids, I've got 2. But there's a belief that in order for a married couple to cement your relationship, you must share a child. A child isn't a psychologist or a marriage counselor. A child doesn't save a rotten marriage. Or a child doesn't strengthen a marriage that has flaws. Either you have a good relationship or you don't. So stop this. When is the baptism? I understand it. But if I experience it like that, I can't imagine the pain it causes those who really do want to have children, who really are of reproductive health and age, and it pains them. And we've got Dr. Susanna here, who's absolutely passionate about the issue and has dealt with a lot of women, so she'll speak from the health perspective. She's got very valuable insights. We've got somebody who's affected or has a conversation to have around her own experiences. I'm obviously speaking from the Office of the First Lady, and from our perspective, it's a topic, so we don't commit to topics unless we're going to back it. So I say one of the most common things I'm asked for is to be a patron of many things, and I decline, because I don't really have time to do a lot of the things. But infertility has become a subject matter that keeps colliding with the work that we're doing. I see our executive director of the Ministry of Gender and Welfare is here, and she'll know, for instance, some of the issues that we're starting to see around surrogate mothers. We can speak about that later, but it does have a link to infertility. We're picking it up in a lot of our gender-based violence work. So gender-based violence isn't just when women are killed or assaulted. It's also financial abuse. It's emotional abuse. It's other forms that manifest themselves. We're picking it up in young people who've been raped, and when they do want to have children, there's long-lasting consequences. So we're picking it up wherever we go as the Office of the First Lady. And the more we're talking about reproductive health, the more we see the extreme hypocrisy of our society. So if a woman doesn't want to have a child, we judge her. If a woman wants to have family planning, we judge her. If a woman can't have a child, we judge her. So I'm not sure where this ownership has come from, what a woman's reproductive path becomes and how complex this path becomes. Some women's infertility comes from all kinds of things. It could be she has to choose between cancer treatment and infertility treatment. There's people where it's a a number of factors. Each one of our paths is different and complicated. But at the end of the day, it's our paths, and we do not need the societal pressure all the time. So to me, I'm as for women who don't want to have a child as I am for women who want to have children, because ultimately it's about choice. And that's where we come from on this. Dr. Rasha will speak for herself. The reason we have a pastor here, and there's a female pastor who was also part of yesterday's deliberations, is church leaders are saying to us, we need help. Increasingly, we're encountering this issue. We don't know what to say. We don't want to worsen issues. Yesterday, one of the participants talked about the impression is almost as if you're not having a child, it's because your faith isn't strong enough. Or there's something, you're not praying hard enough. God is going to deliver. And infertility dates back to the Bible. Elizabeth, there's many women who eventually did come through blessings, and even Mary herself, that was... But that's not how it is anymore. And we have to look at the science. And Abraham, many in the Bible, but it was also an issue in the Bible where women were judged for not being able to have children. So we need our spiritual pastors, we need our healthcare service providers, many of whom are present in this room today, because one of the issues that also came out a lot is attitudes and some of the things that are said by healthcare workers to women and men facing this challenge. So we find there are great healthcare practitioners who are passionate about the issue and who've taken their own time to go onto radios and to really educate populations about infertility. And there are others who are just like, well, tough luck. So attitudes of frontline service providers like pastors, like healthcare practitioners, but also our own attitudes as a country, as family members. Yesterday there were lots of family members supporting their friends. And another thing that comes out increasingly with attitudes is our own attitudes. The things we say to couples who are struggling to conceive, insensitive, uninformed, not helpful. This practice, for instance, where it's almost permitted for a husband to impregnate somewhere else within a marital context simply because there's a suspicion his wife isn't capable of bearing children. Or the terrible myth that extends itself even into HIV, that you must have sex with your sister, with the sister of your wife, if she's incapable of providing children. And the conflict it brings between husband and wife. Many marriages are not surviving the emotional complexity of infertility and childlessness. And we're not even talking about the inequality and how it manifests itself in terms of the cost. A statement that was made yesterday by one of the ladies is that I feel as if my body has become a paycheck for doctors. Treatment can cost from 80,000 Namibian dollars to 200,000 Namibian dollars. People are selling cars, houses, and a lot of this treatment isn't effective immediately or at all. And this is for middle class who can afford access to loans, who maybe have medical insurance. We're not talking about people who do not have the means and who end up going to traditional healers, who aggravate situations. We're not talking about women who have cancer or who have other challenges that they're facing with, and they have to make a decision. Do I go on this treatment or do I go on that treatment? Other women are making decisions about, am I going to study, am I going to start a business, or am I going to save up so I can afford fertility treatment? Then we obviously have men who are also affected because we need the male voice to come out. Fertility is a shared responsibility. And we do want to engage men more in this conversation because at the end of the day, a woman is not just about her reproductive capacity, but neither are men. It is a 50-50 issue. The Holy Spirit no longer impregnates, so somebody has to be doing it. And we want men to be part of this conversation in a very meaningful way. So that's really, so I'm not going to participate anymore in this panel. I want to let the people who are around here. But what I want to say lastly as the Office of the First Lady is, to me, these 2 days are the easy part. It's getting the awareness done. After Thursday is where the hard work sets in. And we've made a number of commitments to each other yesterday that we will immediately establish a network where we will try and do a national committee of people, a support system, and have people in every single region. We will have seminars on these issues. We're having a media training workshop later this afternoon. Tomorrow we're launching a booklet at a school. But we will be a little bit more active and engaged in this topic post this event. We will be engaging some of the policy issues, and I'm glad, Deputy Minister, you were very careful not to set, or rather, you were careful to manage expectations that yes, we're worried about it, but you know, guys, well, maybe sometime, someday, one day. But I think what you made clear is that it is an issue that is coming out, but we need statistics. We can't speak about a challenge we don't understand. So we do want to engage some of the policy issues around funding, and not only from a state perspective, but also from a private medical care perspective. There are challenges around private medical care and what it does provide. But we also know it's only 10 to 15% of this population who have medical care. So we will have to engage the issues around state. We must engage partners like the Cancer Association, Dr. Kimberg, Dr. van der Kolff. We must engage medical practitioners in private practice, because I think that's where we can get a sense of what the statistics and the causes look like, because we can't have statistics and information from public health because they don't treat it. And then I just want to expand on what you said around primary health care and the full spectrum of family planning, which includes infertility, that we must approach this topic from a non-judgmental perspective. We are too judgmental when we speak about reproductive health and rights in this country. And that's partly why we stigmatize and hide and tell each other our own stories which don't make sense, but we believe them. It's because we're putting it underground. So from my perspective no, I'm struggling to say as First Lady. I hate referring to myself in the third party. So from my perspective as Monica, from my perspective as a Merck More Than a Mother ambassador, we are here for the long term. When you see a cattle herder leading cattle, where does he stand? He stands behind. So we're not going to be in the front of this. We are going to support those who are going to champion it. So thank you very much.